Hello, I'm Dr. Jennifer V. Brown, your stroke specialist, and today we're going to discuss what is cardiorespiratory fitness. Easily defined, it's the ability of your heart and your lungs to supply all the oxygen you need to your skeletal muscles while you are doing prolonged physical activity or exercise. And it's measured by maximum oxygen uptake. About that physical activity. It doesn't have to be meaning that you're on a bicycle or a treadmill or how it's measured. You could be taking a brisk walk outdoors at the beach. You could be raking leaves. It's all about the efficiency of your heart and lungs to work so that you can do the things that you love with ease. So specifically, VO2 max is the maximum rate or volume of oxygen your body consumes and then uses during these intense exercises or physical activity. VO2 max is an indicator of long-term health, especially as we age. So I wanted to give you a difference between cardiorespiratory fitness and physical fitness because we usually engage in what we would call physical fitness, but cardiorespiratory fitness is really important. It's just about how efficient your heart and your lungs are to engage in the daily activities that you want to participate in, be it your daily living skills like um, bathing and dressing, or being able to work or do leisure activities. So we really should measure our resting heart rate. The lower your resting heart rate is, that means it beats less per minute and it can last longer over the lifespan. And then your rate of perceived exertion, how hard you are working. You want to be able to rake your leaves, walk the beach in the water, and not be huffing and puffing. And you want your work effort to be perceived as very low. And then measure your blood pressure. Because if your blood pressure is high, you either have too much blood volume and the arteries are too small, and there's resistance to push that blood through. And that's an indicator of stroke and or a hemorrhagic stroke in which there is a bleeding into the brain. And then there's the heart rate reserve, in which the average person finds that difficult to measure because you take and you use a formula, the Carbonin formula, and that's your targeted exercise level that you should be doing in terms of intensity. And most people are not targeting their intensity level for exercise. Then I wanted to give you the descriptors of physical fitness. The number one component is cardiorespiratory fitness, as we just discussed. Then the second is flexibility, because if your muscles and your joints have enough range of motion, you can strengthen your muscles isometrically, concentrically, and eccentrically through that full range of motion. And therefore, you'll be able to do different types of movements with ease as well as muscle endurance. You can sustain and do those movements over time without a decay or breakdown in the quality of the muscle movement. And the last is body composition. It's your ratio of fat mass to lean muscle mass. You want to build muscle mass and reduce your fat mass. And often muscle weighs more than fat. And so you may not lose weight, but you change your body shape in terms of inches. And when you build mass, it seeks its energy source from fat cells. So these are some things I think that you can measure on your own, and you can have wearable sensors. So you can detect your heart rate now, your blood pressure. Um, but those things are important in terms of your cardiorespiratory fitness. And then measure your rate of perceived exertion. I tend to use a scale of 1 to 10 with a color chart with most of my clients. It's just easy, but you can use a scale that goes 10 to 20. And then your blood pressure. Remember, your blood pressure will change in its range as you age. Why? Because we lose elasticity of arterial walls as we age. So the normative model now is 120/80, but as you age, that may change to be 130/80, or your disease process that you may have may cause changes in your blood pressure range. So check with your physician about that. What are some clinical questions I think you should ask your physical therapist, your trainer, your physician, your nurse practitioner? What should be your blood pressure range as we age based on your medical diagnoses? All right. And then have someone instruct you in the Carbonin formula to determine the intensity of which your exercise or physical activity should be at. You have to work at a certain intensity to release all the good things into our bloodstream that will help to lower your blood pressure, manage your blood sugar, and manage your cholesterol. Sometimes we're just not working at a high enough intensity to see the changes in our body that we want. Remember, I am your trusted source for all things ankle foot orthoses and stroke rehabilitation. Remember to like, subscribe, and leave a comment at this YouTube channel. Don't forget about your references. Evidence based practice makes for good clinical practice. And next, we're going to learn about how cardiorespiratory endurance, fitness, as well as physical fitness is important for stroke outcomes. Bye bye. Thanks for listening.